Today's topic of discussion central nervous system pharmacology alcohol பற்றி பார்க்க போகிறோம். Two type of alcohol இருக்கு. One is ethyl alcohol, another one is methyl alcohol. This ethyl alcohol used as a beverage, used for drinking as a beverage in many countries. This methyl alcohol called methanol, not beverage, industrial purpose only, manufacturing of many things. So ethyl alcohol, ethanol, இதை வந்து பிவரேஜாக யூஸ் பண்ணுறோம் ட்ரிங்கிங் பர்பஸுக்கு. ஆனால் இது வந்து நாட் லைக் தட். திஸ் மெத்தனால் ஒன்லி இண்டஸ்ட்ரியல் பர்பஸ், மேனுஃபேக்சரிங் ஆஃப் மெனி திங்ஸ். ஸோ டுடேஸ் we will discuss in detailed about ethyl alcohol, the toxicity of ethyl alcohol. So ethyl alcohol, this one formula of ethyl alcohol C2H5OH. It have both hydrophilic as well as lipophilic property. That combination both water soluble and lipid soluble property. அதனால இதை வந்து amphiphilic molecule சொல்லி சொல்வோம். Now how prepared in alcohol factory? How does ethanol prepared? Prepared from starch. Act enzyme, that enzyme act on starch, which is known as convertase. Okay, and convert that maltose. First take that starch, convertase act on, converted into maltose. Glucose-க்கும் that maltose-க்கும் same formula. So it is prepared by sugar oxidation. So glucose here cymase, it will converted into carbon dioxide and ethanol form. So two product, this one is a carbon dioxide gas form, this one is the ethanol form. In industries, basically it's prepared from starch. First converted starch into maltose, then cymase act on it, finally ethanol form. Next, distillation. What is distillations? Once that ethyl alcohol is prepared, it is distilled. What is mean by distillation? Vaporization, then condensation with cold. So various type of preparation. Vaporization followed by condensation is known as distillation. So it is a purified process to purified. How they do purified? Vaporization, then condensation. Alcoholic, various type of preparation: malted liquor, wine and spirit. So this one, what is malted liquor means? It is obtained by fermentation of germinating cereals. This one is undistilled, not purified. Okay, so here vaporization, condensation and the process illa, so not purified. It is this one pure form, அதாவது டைரக்டாக சீரியல்ஸ்லேருந்து அப்படி எடுக்கிறது. ஓகே, ஸோ டைரக்ட்லி அப்டைன்ட் பை ஃபெர்மெண்டேஷன் ஆஃப் cereals. Alcohol content is very less, very low, 3 to 6%. Example, beer and stout. So here no vaporization means gradually the concentration increasing. எப்போ வந்து நம்ம வந்து வேப்பரைசேஷன் பண்ணுறோமோ அப்போ தான் வந்து the concentration increase ஆகும். ஏன்னா வாட்டர் வந்து எவாப்ரேட் ஆகும், ஆல்கஹால் கண்டென்ட் வந்து இன்க்ரீஸ் ஆகிருக்கும். ஸோ லோவஸ்ட், இங்கே வந்து வேப்பரைசேஷன் ப்ராசஸ் நடக்கலை, அதனால என்ன ஆகுது, lowest alcohol concentration. Example, beer and stout. So lowest alcohol concentration, that's why the taste of the beer is somewhat different as comparing to wine and other liquor. The cereal containing various type of sugars. Second one is wine. Wine produced by fermentation of that natural sugars. Okay, so fermentation of natural sugar, grapes and other fruits. Here prepared from mainly grapes. Other fruits containing sugar, we prepared it from the fruits. This one also undistillated. இங்கேயும் வந்து purification பண்ணுறது கிடையாது. Undistillated, not purified. So alcoholic concentration 16 to 22 percentage. Third type spirit. These are the distilled version. Okay, doing distillation. Concentration 40 to 55 percentage. Highest concentration. Okay, so here example rum, gin, whiskey, brandy, vodka, etc. Okay, so here so this one prepared from anything. First one cereal, second one is fruits, this one prepared from anything. Next, various pharmacological action of various body organ. First one is local effect. A tissue paper dip in ethanol, it gives cooling effect, fast evaporation, feeling cooling effect, that's why used in fever. Take a cloth or tissue paper, dip it in that alcohol, and we can do the sponging. The child can get cooling effect, that is the local effect. Second one is rubbing on the skin produces redness or burning sensation. Then this one balm, pain reliever, so burning sensation. Then astringent effect. What is astringent effect? Means killing only bacteria. So it is used as a sterilizer. 70% is better one. Hardening and cleaning of the skin, prevention of sweating, bedsore that closed. Used to killing the bacteria in the skin, not spores, fungus and viruses. So antibacterial agent, kills only bacteria, so used as a sterilizer. 70% is better as comparing to 90%. Means more evaporation, so more concentration means more evaporation. Most of it will be evaporated in under the skin. It will not be available for killing that bacterium, so 70% is more effective. Second one is central nervous system. It depresses central nervous system. Too much drink means hyperactive, so more talkative, irrelevant action. So brain we having inhibitory mechanism. There is a feeded background that things we have to do publicly, what things we don't have to do publicly. So to say in front of that everything, we don't have to say that is feeded in there is the inhibitory mechanism, prevent us from talking, doing those activity in public places that should be done. But that alcohol depresses the complete the central nervous system, so depresses inhibitory mechanism, leads to over talkative or over hyperactive. It depresses that that reticular activating system also, that's why person feel sleepy after drinking. Depress inhibitory mechanism, loss of that inhibitory mechanism, the loss of that inhibition, and the person enjoying social company. So loss of inhibition and the person enjoying social company, can be extreme happiness. more drink, more concentration in that blood, and so more going to the brain, so more depression on that central nervous system. It depends on the concentration in that blood. So alcohol considered as great mimicker. The mood may swing to extreme happiness or extreme sadness. The effect on central nervous system is directly proportional to the concentration in the blood. The depression progresses as the blood concentration is increases. So here up to 20 mg percentage means person is relaxed. So relaxed, he started to sleep up to 30 percentage relaxed, and here relaxation also will happen. Excessive talking, அதிகமாக பேசுவாங்க. நெக்ஸ்ட் அப் டு 50%ங்கிறப்ப எட் கண்ட்ரோல் ஒன்லி, கம்ஃபர்டபுள் ஆல்சோ அண்ட் சாட்டிஸ்ஃபைட் ஆல்சோ. ஹியர் நோ ப்ராப்ளம், தேர் ஆர் மூவபிள் ஒன்லி. But more than 100 mg percentage means uncoordinated with slurred of speech. இப்போ வந்து பேசுகிறதெல்லாம் குளறிடும். More than 200 mg means intoxicated. So but still mobile, இங்கேயுமே மூமெண்ட் இருக்கும், பட் here toxic ஆகும். Last one is more than 300 mg stupor. But that means unconscious, can't walk, can't speak. Then more than 400 mg percentage means this one leads to this one deadly drunk coma. So finally leads to death also. Next, what is hangover? After sleeping the next day morning, the person have withdrawal symptoms. The person have headache, dry mouth, laziness, disturbed mood, impaired performance. இந்த கண்டிஷனுக்குலாம் நேம் வந்து hangover. So seizure may be precipitated in epileptic. அந்த பர்சன் வந்து எபிலெப்டிக் பர்சன் ஆல்ரெடி அவங்களுக்கு தெரிஞ்சதுன்னா கண்டிப்பாக வந்து அவங்க இதனால வந்து அவங்களுக்கு சீசஸ் வர சான்சஸ் இருக்குது. ஸோ lowering threshold for seizure. This one, epileptic person take too much alcohol, seizure can be precipitate. Next, what is the action of that CVS? Okay, heart and blood vessels. So here small dose not affect blood pressure, but moderate and large amount only affected the blood pressure. Moderate mild rise in blood pressure, large one fall the blood pressure. Okay, so here direct myocardial and vasomotor central depression because of that reducing that blood pressure. Low blood pressure leads to arterial fibrillation. That means which refer to holiday heart. அவங்க வந்து ஹாலிடே அப்போ அதிகமாக எடுத்துக்கிறாங்க, அதனால் வந்து அவங்க blood pressure வந்து ஃபால் ஆகுது. Next, what is the action of blood? In blood increase good cholesterol and decreasing bad cholesterol, doing good for lipid profile. Okay, so good cholesterol increase achna what will happen? Productive coronary artery disease. But drink small amount of alcohol daily, less than 3 drink, productive action. And comparing to good, more harmful effect. அதாவது 1% தான் நல்லது, 99% வந்து harmful effect. So adverse effect are more comparing to good thing. Then body temperature. What does to the body temperature? Alcohol is reputed to compact cold with the cold, so it gives a sense of warm. So cold temperature. Winter people used to drink brandy, various preparation of that alcohol, so it will give sense of warmness. Why? It causes cutaneous vasodilation. இது வந்து என்ன பண்ணுதுன்னா vasodilation பண்ணுது. So blood vessels of the skin get dilated. That's why more blood in the skin, so it is giving sense of warmness. There is a sense of warmness in the skin. Then respiration. Initially, it stimulates that respiratory reflexy. Okay, initially stimulate that respiratory reflexy. Later on, depress that respiration causes death in the too much drinking. Coma more than 400 mg percentage means the person will die because of the depression in the brain. The person cannot respire. So initially, it irritate that pharyngeal and buccal mucosa. So there is a reflex. It will stimulate that respiratory reflex. So when the person start to drinking alcohol, initially the respiratory rate increases, but later on it will decreases. So ultimately can causes death also. Next, what is the effect of liver? Gradually, the alcohol caused cirrhosis in that liver. This cirrhosis is the end stage. There is no treatment of cirrhosis, only treatment in liver transplant. So, that liver cirrhosis causes here, நான் எப்படி வந்து liver cirrhosis cause பண்ணுதுன்னா accumulation of fat and protein. Accumulation of fat and protein in the liver, it causes injury to hepatocytes, leads to cirrhosis. So என்னாகுது ஆல்கஹால் எடுக்கிறப்ப அது வந்து நாட் டாக்ஸிக் டு லிவர். இட் வில் இங்கே வந்து ஆல்கஹால் டீஹைட்ரோஜினேஸ் என்சைம் அதிகமாக அன்லிமிட்டட் அமௌண்ட் ப்ரெசென்ட் ஆகிருக்கு. இது வந்து அசிட்டால் டிஹைடாக கன்வெர்ட் ஆகுது. இதுதான் டாக்ஸிக். நார்மல் எப்படி ஆகும்னா திஸ் ஆல்டிஹைட் டீஹைட்ரோஜினேஸ். ஸோ 2 type of enzyme. ஆல்கஹால் டீஹைட்ரோஜினேஸ் வந்து ஆல்டிஹைடாக மாற்றுது. திஸ் ஆல்டிஹைட் வந்து அசிட்டேட்டாக கன்வெர்ட் ஆகும். எதனாலனா ஆல்டிஹைட் டீஹைட்ரோஜினேஸ் என்சைம் மூலமாக. இது வந்து லிமிட்டடாக இருக்கும். அந்த பர்சன் வந்து க்ரானிக்காக இருக்கிறப்ப என்ன ஆகுதுன்னா இந்த என்சைம் வந்து லிமிட்டட் அமௌண்ட்டாக இருக்கிறதுனால இது அவைலபிளாக இருக்காது. அதனால இது வந்து அசிட்டேட் ஃபார்ம்லேயே இருக்கும். இது வந்து டாக்ஸிக் ஆகும். அதுவே வந்து கம்மியாக எடுத்துக்கிட்டாங்கன்னா அது வந்து அசிட்டேட் வந்து என்ன ஆகுதுன்னா கார்பன் டை ஆக்சைடாகவும் வாட்டராகவும் மாறுது. யூரின் மூலமாக வாட்டரும், கார்பன் டை ஆக்சைடு வந்து எஸ்பிரேஷன் மூலமாக பாடியிலேருந்து வெளியில் போயிடுது. ஸோ ஹியர் லிமிட்டட் அமௌண்ட் ஆஃப் ஆல்டிஹைட் டீஹைட்ரோஜினேஸ் என்சைம் இருக்கிறதுனால இந்த அசிட்டால்டிஹைடு வந்து பாடியிலேயே அக்குமுலேட் ஆகிட்டு டாக்ஸிக் எஃபெக்டை ஏற்படுத்துது. So acetaldehyde produced during metabolism of alcohol appear to damage the hepatocytes and inducing inflammation also. Next, what is the actions of alcohol on kidney? It is diuresis. When a person drink a alcohol, after that he has more urination. That is known as diuresis. Because what is the reason? Alcohol causes inhibition of ADH secretion in that posterior pituitary. ACH not acting. Okay, so here sodium and water retention. No water and sodium retention. Because of that inhibition of ADH, it will leads to diuresis. Antidiuretic hormone is not acting because of no water and sodium retention. Because of that inhibition of antidiuretic hormone, it will lead to diuresis. So alcohol causing inhibition of antidiuretic hormone. So no antidiuretic hormone means no water and water sodium retention. Finally ADH causes water and sodium retention, but no ADH means no water and sodium retention. So more urine, that's why diuresis. This is how leads to alcohol. Okay, so last one is what is the action of alcohol in sexual functions? After drinking alcohol, the person feel aphrodisiac. What is the meaning? This is the substance that stimulate sex drive. So due to loss of inhibition. So the person have more sex drive after drinking alcohol because of loss of inhibition. Inhibitory center in that brain get lost. That's why the person have more sex drive. Teratogenicity. What is action of that alcohol on that pregnant lady? If a pregnant lady consuming alcohol during pregnancy, it can causes harm to fetus. Okay, what are the things? What does the fetus will have? The symptoms is known as fetal alcoholic syndrome. Um, mental retardation, slow growth, microencephaly. It have small brain of that fetus not developed. Okay, facial abnormality, small function formation, increasing risk of infections. So today's topic of discussion, pharmacological action of ethanol. So first one is local effect. Second one is central nervous system. Third one is CVS, cardiovascular system. Then blood, body temperature, respiration, liver. So acetaldehyde trapped into the liver cell hepatocytes, and this acetaldehyde is toxic for that liver cell. It will causes damage to the liver cell. That's why it leads to cirrhosis. Kidney sexual function, teratogenicity. All the things discussed. Thanks for watching.